The assessment of the cardiac patient. The majority of this chapter is a review for you. So please review your A&P and health assessment independently. Paying close attention to the assessment of types of chest pain, differentiating between the difference between angina and an MI pain. And that is table 30.2. This semester, we'll be talking about angina, which is usually sudden and is a response to exertion, emotions, or extremes in temperature. It usually lasts less than 15 minutes and is relieved with rest, nitroglycerin, administration, or oxygen. A myocardial infarction, which you will cover next semester, is the pain is continuous and does not have precipitating factors. Also, I want you to look at the functional classifications of cardiovascular disability on table 30.2, which is on the next page, page 622. It's basically saying that patients with class 1 cardiovascular disability do not have limitations, going up to class 4 cardiovascular disabilities, and these patients are unable to carry out physical activities without discomfort. And we'll be talking about that more during our chronic angina lecture. The next few series of slides are diagnostic tests that may be performed on your cardiac patient. The brain peptide, or BNP, is secreted by the ventricles of the heart in response to the increased blood volume and pressure, and these levels are elevated in heart failure. We should know by now what PT and PTT are. They are assessment of anticoagulants. Your CRP is elevated with infection, smoking, hypertension, and in the cardiac patient, it's helpful in the management of determining risk for heart disease and the management of statins after an MI. Serum lipids are elevated, an elevation of serum lipids increases the risk of heart disease. Troponin is the myocardial muscle protein released into the bloodstream with injury to the myocardial muscle. So you only see this if you have acute injury or MI in the heart. So troponins will be more important next semester. But the reason we're going to talk about them just briefly this semester is because we will be drawing them sometimes on our angina patients before we have ruled out an MI. Cardiac catheterizations are covered in 495. Do take a brief moment just to peruse the table 30.4 for indications of a cardiac catheterization on page 628. A lot of times it's if you have someone who has unstable angina or has stable angina that is severe and not being relieved by medication. It's basically if they're thinking that there could be a blockage. So that's the reason we're going to be looking at doing a cardiac catheterization. Angiography is something we're going to do. It's an invasive diagnostic procedure, and it's used to look at the arteries under fluoroscope. So we're looking for narrowing of arteries, obstructions, or possible aneurysms. An exercise electrocardiography is a stress test. What that is the assessment of the heart's response to increased workload. It helps to determine the functional capacity of the heart and screens for asymptomatic CAD. We also may see our patients ordered a chest x-ray, both PA and lateral. This is to look at both the posterior anterior view and left lateral view of the heart to determine the size, silhouette, and positioning of the heart. Echocardiograms are used as ultrasounds to assess cardiac structures and especially the valves, to see the blood flow through the valves to look for regurgitation or lack of closure. A transesophageal echo, or a TEE, does it's the exact same thing as an echocardiogram, but it's done with a transducer placed immediately behind the heart in the esophagus to get the posterior cardiac structures. Nuclear imaging can be done both as part of a stress test with nuclear imaging or with radio. It's what myocardial nuclear perfusion testing is radioactive tracers are used in conjunction with either exercise or chemical stress tests. A chemical stress test is when medications are given to increase the heart rate instead of actual exercise. So again, these are just for you to be able to take time to look at the different diagnostic procedures that patients with heart disease may have. So the majority of this chapter should be a review for you. And I did just go over the diagnostic assessments very briefly, and they will be talked about again within the chapters as we're covering them in lecture.